the broadcast using both the questions and chat features in the toolbar on the right-hand side of your screen. Please note that this is the only way to interact with us today, as all attendees will be muted. This webinar is part of a series that is sponsored through Milan, and we are very grateful for their support. So thank you, Milan, for today's webinar. Our speaker today is Lori Enriquez. Lori has lived with an allergy to peanuts her whole life, and she also has an intolerance to gluten. She is a registered dietitian and a certified health education specialist with a dual Bachelor's of Science degrees in Nutrition and Food Science and Information Systems from Drexel University, graduating with a Master's in Public Health from Temple University. She has partnered with one of our legacy organizations, the Food Allergy and Anaphylaxis Network, to complete her award-winning master's research on food allergies, studying the knowledge, training, and policies in Center City, Philadelphia restaurants. Lori is an active contributor in the nutrition community and is a member of the Academy of Nutrition and Dietetics, Pennsylvania Dietetic Association, and is a lifelong member of FAIR. Lori has been a presenter at our conferences in the past, and she will actually also be doing new presentations at our upcoming conference in Long Beach, California in May 2015. Her nutrition and health consulting business is eatfithealth.com, and she resides in Via, Pennsylvania with her husband and daughter. At this time, I will now turn the presentation over to Lori.
Hi, everybody. I want to thank FAIR and Lynn for having me today for this webinar. It's very exciting for me, not as a dietitian, but as somebody with food allergies. I want to give just a little additional background on my allergies because people usually like to ask about that. I was officially diagnosed with a peanut allergy when I was 2. I also, at a younger age, had a fish allergy and a milk allergy, but I outgrew them. And like many of you know with peanut allergies, the majority do not outgrow that. So I do still have the peanut allergy. And when I was a child, there was no FAIR, there was no group, there was no education about how to do all of these things you need to do in life with your food allergy. So a lot of these things I'm going to go over today are going to be sort of based on things I've learned over the years. And with the advent of FAIR and the internet and all of these other resources, it does make it, in my opinion, a lot easier than years before. Next slide, please. So when you see this quote, this is definitely not a good quote for somebody with food allergies, right? So I think it's supposed to be meant that you're enjoying your journey and, you know, you may go to different places along the way, but when you're traveling with a food allergy, you really do need to have some plans and do some planning ahead. And you also obviously want to arrive safe. And so when I see this, it sort of gives me the cringe and the chills, you know, thinking about some of the situations I've been in before when traveling. Next slide, please. So FAIR has a lot of great information on their website. I'm sure many of you have already explored that if you've registered for the webinar. But if you haven't really had a great chance to explore everything, I would take the time and go through all of their information. I mean, it's chock full of great information that you can use, print out, and share. And some of these statistics they have on the website tell us the importance of how often a food allergy reaction occurs. And so every 3 minutes, there is a reaction that sends somebody to the emergency department or the ER room. And that's a lot. I mean, that's happening all the time as well. When we look at statistics of who are the highest risk for fatal food reactions or, you know, anaphylaxis, it's teenagers and young adults. And so that sort of makes sense because when children are younger, you know, you're with your parents more, your caregivers more, who can, you know, be looking out for you. And when you get into that independence, you know, they're going off on their own with their friends. So, you know, remembering to take medicines and use all the precautions for some may go by the wayside a bit. And so this is especially important to continue your food allergy training at different stages of your child's life or your life to readjust, you know, as needed. Next slide, please. So today in our talk, I want to give you some practical tips for traveling with food allergies, some of the different challenges and lessons that I've learned, some of the various resources for traveling, which you may be aware of some of these, and hopefully encourage you to explore the world. So, this is actually a picture of me as a teenager. I was 13. My grandmother had taken me, I was very lucky, on a trip for a month to Kenya. It was through the Friends of the National Zoo, which is the Smithsonian-based zoo in Washington, D.C., and they had a sponsored trip. And she wanted to take each of her grandchildren on a trip, and this was the lucky trip that I got to take. So I'll tell you some about that. But certainly a world away and completely different, and I think this really sparked my interest in travel, for sure. The other thing I just want to mention is I don't know that there's really one right way to plan for your trip. I mean, these are going to be things, these tips that help me, but you might find certain ways that help you. I mean, there's certain things I think everybody needs to do, and I'll highlight those. But it's not like it's, one rule book on how to go about planning your trip. There's some, differences that you can consider. Next slide, please. So some of the safety concerns when you're traveling, there's a lot of safety concerns. At home, you know what you bring into your kitchen. You know how you can prepare your foods. You know what the ingredients are that you use. However you've set things up at home to be safe, and often at home you also know which restaurants around the area can accommodate your food allergy and sort of how you can maneuver all those situations as well. So when you're traveling, especially to a place you've never been before, often you do need to eat out. You may not know, what kind of restaurants do they have or where they are or can they accommodate your needs. Not having a kitchen is sort of a big barrier for some people, especially if you're going to be away for longer than a couple days. Having a kitchen allows you to purchase safe foods or bring safe foods and prepare them where you know there are. So that could be an issue. It might be easier, in vacation mode, people are a little more relaxed, they want to explore. So it might be easy for some people to feel tempted to take risks. Oh, I really want to try this regional cuisine or this special item that they have there, when you're not sure if it's really the best choice. And when you travel, I would love to be able to eat a lot of different things that everybody else eats, but some of the street food, may or may not be a safe choice for you. And what I mean by that is it could be a cart or a stand that's set up to sell something regional. You may have difficulty. What I found in some of the other countries, I've had more difficulty communicating with language barriers and things in places like that versus a formal restaurant. And the other thing that can really happen, and this happens a lot, so I try to always, have the safe snacks with me, is being hungry. When you're traveling, and even if you're not on a set schedule, there can be delays in getting somewhere, whether it's an airplane or traffic or something. And, when you're really hungry, you're going to want to eat almost anything. So you might be more likely to take a risk at that point. Being in the moment and feeling you're missing out. So, I mean, there's a lot of times I can honestly say, I'm in my 40s, so I've had this a long time, that, you do feel like you're missing out. And I think that's just part of having the allergy, and there's certain things you can do to make that not happen as much. And I live in an area where I know that there's several hospitals nearby, which is kind of lucky. But some of these places I've traveled to, or other places that you may want to go, might be farther away from emergency care, or you're not sure where they are, and so that might be a little concerning for you. So you might want to consider finding out about where those are. And then the last thing that came to mind for me was, when you go to other countries, or even regionally in the United States, some areas tend to use different ingredients than they might in your local area. And so one example of that is for the last 2 years, I've participated in the Rock and Roll Half Marathon in New Orleans. And when I started researching for this, I was surprised at a lot of places that had peanut products on their menu, as well as peanut oil, which I wouldn't have really thought of without doing the research or having been there. So, kind of figuring that out can help too. Next slide, please. So some of the places I've been to, I would like to go to a lot of other places. I've been to South Africa and Kenya. South Africa was a few years back. I had a good friend of mine was working there temporarily, so I was like, oh, we have to go. So we went there for about a week and did a lot of exploring. I'll talk a little more about that later. I haven't been to too many places in Asia. That is one that would be considered higher risk, some of the countries with the peanut allergy. Australia I went to as a child for a month for a sports team. I played lacrosse. And that I stayed with two different host families. So that was a different experience, but I was by myself, no parents or siblings with me. I've been to a couple places in Europe, all across, the United States and Canada, which I find is very food allergy friendly. Some of the ways I've gotten these places, the airplane, which to me is the biggest, the one I feel is the riskiest for me. I mean, you do it and you have to do it, but you want to take precautions. Bicycling, boats and cruises, that could also be somewhat concerning for people. You want to plan because you're out there in the middle of the water, without too much emergency care. Buses and trains are kind of similar. I mean, you definitely could have people that you're sitting next to that might be consuming your allergens and other issues that you need to think of, and car and even hot air balloons. So I've been able to negotiate this and figure out to have successful travel for this. Can we go to the next slide, please? So before you go, and this is what I've sort of learned, when I first had the food allergy as a teenager and even young adult in my 20s, like I said, I didn't have any formal training, from the doctor or anybody else. I probably didn't plan that well, and I had a couple situations that I'll get into that caused me a little bit of an issue. But now I know better, and so I plan before I go. So I will go to FAIR's website, and they have information on airlines, and they update that often. And I will start there to see, okay, what might be an airline that I want to choose based on their policy. And then when I make my reservation, I will communicate that. If I'm making it online, I type it in, and then I call later and speak to a person and have them type it in. And this is really important because the policies are all very different and how they do it, and I've seen them change over the years. Some of the airlines used to actually make an announcement and say, we have, somebody with a food allergy. I was always worried they were going to say, C15 or, person has a food allergy. Please do not eat anything. But I have not been on an airplane recently where they make an announcement, but I usually alert the flight attendants when I get there just so they know. And you just want to communicate early on and sort of figure that out. The other thing to consider, which may or may not be just allergy related, is if you're going to go out of the country and it's an area that may have different health risks, public health risks, then you may want to consider going to a travel clinic to determine any of those risks, if there's possible medications or immunizations that are suggested. And I've done this several times, definitely when I've gone to Africa and had some special immunizations and medications for that, if you're at risk for malaria or other types of things. And I have also bought travel health insurance before, which I would have never thought about, but I always worry if something happens and, maybe their health care isn't as good as what I'd think. Is there some way that the travel insurance would get you better care or worst case scenario out of the country? So that is definitely a consideration depending on where you're going. I wouldn't say that necessarily everybody needs to do that. And travel health clinics can be easily found at a lot of big teaching hospitals. So in the Philadelphia area, I know several of the big health systems do have travel health clinics. Okay, and then if you can, especially if you're going for more than a couple of days, if you can consider staying at a place that will either have like an efficiency kitchen or a small refrigerator, that would definitely be helpful, especially you can cut down your money on eating out as well as your comfort level of providing safe foods. And so one thing I've learned is that many hotels often will provide a small refrigerator for medical needs. So I actually did do this for the conference in May. I had called the hotel, and there's not a small refrigerator in the room, but they will be providing it for medical needs. So in addition to food allergies, there are a lot of people that have other medicines that have to be refrigerated or other things. So If that is helpful to you, often they will do that without a fee, an extra fee, and sometimes I've been charged a nominal fee for having the refrigerator. And there's a lot of things that you can heat up quick or just with hot water. Some places do have access to microwaves and things like that if it's not a full kitchen, but those are questions that you can explore ahead of time. The other thing is I carry my emergency medicines with me everywhere. I mean, everywhere I go, I take them. But when I'm traveling, especially if I'm going somewhere pretty far, I bring extra. So, you know, I may bring 4 EpiPens, you know, instead of 2 EpiPens, or 6 EpiPens, or, you know, more Benadryl or inhaler, whatever your emergency medicine is. You may want to bring extra when you're traveling, and you definitely do not want to have it checked on if you're on an airplane. You want to have it on your person in case it's needed or, you know, something happens, and also keeping it at a temperature where it's supposed to be. So the one thing I've learned is doing some research ahead of time really, really, really can help you have a better experience, because there's nothing like going on vacation and then being stressed about where am I going to eat, how am I going to fit this in. So a lot of research can be done in many different ways, and it really depends on what you prefer and what you have access to. I do it in a lot of different ways depending where I am. I mean, I may search some of the allergy groups and post in. I've posted before. Does anybody know of a place that accommodates allergies in this? There are some resources at the end that we will go over. You know, I will search those resources as well. I've even messaged restaurants on Facebook. You know, I've researched some restaurants in an area I'm going to, and I'll send a message. Can you accommodate a peanut allergy? And depending on the response will depend on how I might pursue that further. If right away they're like, oh yeah, we're good with that, we have policies, you know, we're familiar, we take it seriously, then I know that might be a place that I'm going to consider. Or if they're like, we don't use any peanuts, you know, I know for me that's something to consider. If they're like, oh no, that, you know, you get a response, then that doesn't seem very sure, then you might cross that off your list. So I would say there's a lot of ways to do that. You can also research about the regional cuisine to maybe find out more about some of the types of foods that might be there if you're not familiar with them or the ingredients, see what might be high risk or not high risk. And, you know, if you're staying at a resort or another place like that, you can communicate ahead of time to see, you know, would they be able to accommodate you? Are they knowledgeable about it, as well as the resources? So I usually try to do some research ahead of time, and I keep it in a folder or a file. I make a list of possible places that I might be able to try, and then I have other strategies once I actually get to my destination. But this will allow you to have more time exploring your destination than worrying about where you're going to eat. And even if you're traveling with kids and you're going to a ball game or a amusement park or an aquarium, a lot of those places, at least in the U.S., do have information on their website if you're allowed to bring food in or not. So even around here in Philadelphia, for example, the Camden Aquarium, you're allowed to bring food in, which is great for food allergies. Some of the other places, you're not, you know, supposed to bring food in, or you're not allowed to bring food in. So it's good to know those things ahead of time. Next slide, please. So what do you pack? So I'm going to laugh about this because when we went to South Africa, I had packed a carry-on cooler with lots of food, as I knew we'd be in some remote areas, and I had never been there before, and I was not really sure how this was all going to work out exactly, even though I had done some research. So I had this giant cooler. Like, I kept putting stuff in, my safe foods. For me, you know, if it could be like a meal replacement, I would have some protein bars, you know, canned chicken, things, different things. And my husband's like, we have to reevaluate this. It was so heavy, I couldn't even carry it. I just got a little out of control about it, and then I went through and, you know, prioritized how much I was going to pack with that. But, you know, generally, besides all of the emergency medicines, and you can carry your emergency care plan, you want to actually have extra safe foods. So obviously, some foods do not travel very well, and some foods travel well. So you want to think about which foods, you know, considering your allergies, are the hardest to find or replace, you know. So if you have multiple allergies and you're on a special formula that you drink, obviously you want to bring that. If you have, you know, something that you consume all the time or your child has all the time, you may want to include that if you're able to. For me, snacky foods like potato chips or Doritos or tortilla chips or something like that is pretty easy for me to find anywhere. So I try to focus the things I bring on things that are a little bit harder to find. The other thing you want to do is have, wet wipes or other cleaning products. Certainly on an airplane, you want to, clean the area. A cooler, as I've stated, even if it's not for your food, which can be useful. Also, if you're in hot temperatures or at the beach, you may need to keep your medicines at a cooler level, so that could be helpful. And chef cards are very helpful, and FARE has a lot of these options in different languages on their website, so you can take your allergens and convert it into the words in that language. And so I would do that, and I would do, if you're going to a country with another language, I would have several copies of the one in the other language, but I would also have them in English, because sometimes when you're traveling to countries that speak other languages, you may find that there are some people who speak English, and so that may help as well. You obviously want to bring your notes or, on any research you did, and a backpack or messenger bag or fanny pack or something where you can carry your emergency medicines and some snacks along the way. So I usually will take a backpack with me because it's just easier to carry, and then I can put multiple things in that. Next slide, please. So we talked about some of this. The other thing at the airport you may want to consider is a letter from your doctor confirming your allergy and carrying your medicines with you. So I've actually, I feel like I should always knock on something when I say this, but I've actually never been asked for a letter. The epinephrine or the emergency medication has been scanned right through scanners at an airport without a problem. What I do though is I will bring the box. I keep the box with the original labels so it shows what it's for as well. Although I don't always carry the original box in my purse, but I do keep them for when I'm traveling like that. The other thing is, if you know you're going to certain airports, a lot of times the airports nowadays will have information about what food they offer at the airport. And so you can search ahead of time to see if you think there might be an option for you of eating something if you're connecting a plane or you're waiting or not. I've had some airports that have a lot of options for me and others that don't have a lot of options. Some of them nowadays will have like a mini grocery store with a lot of packaged food, and often I find they have a few allergen-friendly brands, but every airport is different. As I mentioned before, I do alert the flight attendants at my allergy early on, and cleaning the seat and the seat tray when boarding the plane I think is very important. And the one thing that I've learned over the time is I never eat anything. I should never eat anything that's risky, but I never eat anything that's risky in flight, meaning I usually will consume either something I made at home that I brought with me or something that is packaged with a label that I've evaluated, or some of my favorite allergy-friendly brands is usually what I do, because I just worry about having an issue with that. And you definitely need to communicate your allergy if you have any seatmates. When we get into challenges, I'll talk about some of my experiences with that. But if you're traveling by yourself or you're sitting with strangers, it's something that I would definitely make them aware of. Next slide, please. So another thing to consider are all-inclusive resorts or cruises. And we've been to several of these over the years. And luckily, I've been able to be accommodated at all of the ones that I've been to. I will say, however, though, certainly I'm not eating everything that they offer. So, for example, I've been on several cruises. The easiest one, of course, it's going to sound like a commercial, but the easiest one to maneuver was a Disney cruise that we went on, because as many of you know, they're very food allergy friendly and they take it serious. Some of the other cruises, they had options for sit-down dinners versus buffets. And so often we would do the sit-down items that were needed instead of the buffet, just for feeling that the communication and the preparedness might be less risk of cross-contamination. And then other places we've stayed on site that offer, food in the meals, we've been able to contact ahead of time and let them know. If you're working with a travel agent, they might have contacts at all of these destinations, so you can determine what might best fit your needs. And oftentimes, at least on a cruise, there's usually a doctor or a nurse on site, which definitely is helpful to let them know about you and your allergy, as well as, of course, to have your emergency medication. So before you go, I usually, if I was doing something like this, I follow up several times to make sure that they know that it's recorded and it wasn't, caught through the cracks somehow. And then upon arrival, I would usually communicate right away, I have this allergy, just want to remind you as to what, and go through if there's sometimes a chef will come out and talk to you about, things you should do or not do, etc. And the buffets are cautioned for all buffets. I have eaten at buffets before, and I'll tell you more about that in a bit, but you want to use caution because if they have your allergen, at one side, people often mix up tongs or pieces of the food spill on each other, or, if somebody's refilling it, they may use the same utensils, or there might be cross-contamination with that, which is why it's so risky. And then another thing that I have noticed is, if you're at a place that has multiple types of restaurants, for me, usually, Thai food or Chinese food is high risk for my allergy. So those types of restaurants may not be safe, but if they have an Italian restaurant or an American-style restaurant, that one might be okay. So those are things to determine and figure out what is the better place for you. Are there different kitchens that are prepared, and what might be the best for you. Next slide, please. So here's where we got with health insurance. So this is an all-confusing topic, but you can call the number on the back of your health plan to find out, depending on where you're going, if there is any kind of coverage for you in an emergency. So, it depends, I think, as well as if your plan is commercial, or if you happen to travel for work, they might have different kinds of health care coverage that covers you internationally if you're traveling for work. But if you're not sure, you can call, your plan and find out. If needed, you can consider purchasing. There's a variety of places that you can buy different types of emergency coverage at a country. I'm not an expert in all the different plans, but you can research this online, and I have bought plans through MedX before. Luckily, I have not had to use them, and I'm trying to remember exactly how much it cost. This one has been a few years, but it was reasonable. Maybe for my whole trip, maybe $100, which for traveling to a remote place, I felt was well worth it. So those are just some things to consider that you may not have considered. Next slide, please. So when you're eating out, there was one question that came in early on that said, a lot of times they read food blogs and they say that if you have allergies, you shouldn't eat out at a restaurant. Well, in the ideal world, we could control all our settings, and yes, we would have a safe kitchen at all the time. However, I like to travel. I like to explore. We're a busy world, so I don't personally feel it's realistic for most people to never eat out. So when you're choosing places, you want to choose, places that will be able to accommodate you. So in this picture, this was a restaurant that we found in Mexico City, Mexico last spring. We were there for a couple weeks for my husband's relative turned 100. It was a special celebration. And so this was a place we found that was able to accommodate my allergy. When you travel to Mexico, besides the allergy, you have the added issue of trying to be cautious with raw fruits and vegetables and ice, because their water has different bacteria than us, and many people can get sick from the traveler's diarrhea. So it did make it a little bit more complex, having to avoid so many things. When we came home, I was ready to have full access to, more foods. But if you know where, if you know what town you're going to or what area, it's a lot easier in the United States, but you can search for menus online. So a lot of times if I see a couple restaurants I may want to try. You know, for me, usually Italian, American are sort of safe bets to start. I will look at the menus. I will sort of search it ahead of time. If I see too many peanut dishes on the menu, then I avoid that place. I feel like it's going to be high risk. If I see, you know, a statement that says, please let us know if you have food allergies, or I don't see a lot of risk, then I might then contact them to see if they would be able to accommodate, you know, my needs. So that sort of helps me. I have even used, you know, the internet at the hotel, you know, in between to sort of check things out and then contact as well. But you can do a lot of stuff ahead of time. If you're making reservations online and they use like an online scheduling, and you know you've had a conversation about it, you can also type in your special food needs and requests. And if you happen to have, you know, multiple food allergies, you know, you may want to make some suggestions as to what would be okay to eat. You know, if you know that your child can have chicken and broccoli and rice, you know, you may want to ask, can you make this, you know, without any sauces or seasonings and free of these allergens? You may want to suggest it. That's another thing. And then communicate. So this is all throughout the way. Well, you know, when calling to investigate, when making any kind of reservation, you know, before you order, all of those things. And then, you know, I usually will even ask then once the food arrives, right? So I was fine with this choice, you know, there's no peanuts, right? And I try to ask multiple times just to make sure that they realize the importance. The chef card comes in very handy here when discussing your allergy and your needs, and obviously having your emergency plans and medications. I always feel like I'm going to jinx myself when I say this, but people always want to know, have you had any reactions? Did you have to go to the hospital? And I'm going to knock on something, but my last 2 emergency room trips for reactions were at restaurants, and they were at restaurants that were within 10 miles of my home, not out to eat, and I had followed all of the steps and everything, and accidents can happen. You know, they both times, ironically, were salads, so my friends keep telling me, you got to stop trying to eat healthy. There was a whole process at the one place, and then they had typed in their system, no peanuts, and, you know, they assured me, and I checked ahead of time, and the person in the back of the kitchen just focused on peanuts and put some kind of peanut sauce in the salad, and I could tell right away. For me, my reactions, everybody's different, I know, are usually sudden. So once I get that feeling, I know. So I administered my epinephrine and off to the ER. And, you know, they give you additional treatment, and then I was okay. And the same thing happened for the other one. It was a communication error, a different restaurant, and the owner actually ended up taking me to the ER. So even without planning, you have to be realistic that it can happen. You know, you want to know your emergency plan, and, you know when your allergist wants you to administer your epinephrine. You don't want to delay it if that's something they want you to administer right away, because that can worsen the outcome. Okay, next slide, please. So in the United States, I feel it's a lot easier to plan and travel and research. You know, you kind of can reach out to people that you might know from all over the country. You can tap into the FAIR support groups. You know, you could reach out to different regions. Do you know a place that can help with these allergies, or what would you recommend? I think it's a little easier to learn about some of the regional differences. And, you know, it's a lot easier sort of to plan and travel. I am going to emphasize again that Disney is very great with the food allergies. So I've been there a handful of times. I've done 5 half marathons there, and it's always a real vacation for me because they get it. You know, anywhere I go on their property, I communicate. I get great service. I get the chefs out there talking to me, and I feel really great about that. So it makes my travel a lot easier. Next slide, please. When you're traveling alone, you know, especially as your child gets older or if you're an adult, you definitely have some different precautions to take. So, of course, if my husband's with me, you know, he knows all about my food allergy. That's like an extra person looking out for me. But when you're by yourself, you do probably need to let the people next to you know that you have a food allergy, and you have to use good judgment with that. And so I recently had this happen. Actually, was it January? Just this February, when I went out for the run this year in New Orleans. There was 2 seats in my row, and there was another girl who was also going out for the marathon, and she was sitting next to me, and she was talking to her friends across the aisle, and we were on the runway, and before I could even really say anything, her friend was like, "Oh, so do you want the M&Ms?" And I was like, "Oh my God." So I was like, "I have a peanut allergy," and they were peanut butter M&Ms, and so she was very kind, did not eat them, and either did the people next to me at first. She's like, "Well, can I eat them?" And then she's like, "No, I won't eat them." So I usually, especially when I'm traveling alone, if I bring safe snacks on board, I usually bring extra snacks to offer people, because if that's what they brought to eat on the plane and now they're willing to give that up for me, I bring something that I could share with them. So I did offer them some of my food, but they said they were okay with it, and the flight wasn't very long. But you do kind of have to communicate. Other times I've had a guy without a whole can of peanuts right next to me. Even though they don't serve them on the plane, people can bring their own food. And I switched seats so that he could eat his peanuts, and I was in a different row far away where I didn't feel like it was an issue. So these things can happen. I strongly believe in wearing a medical alert bracelet, especially if you're by yourself. I mean, this is for any medical condition, but especially food allergies, because if forbid something happened to you, they would know, what your problem is. So mine, actually, I have a couple of them, and I never take them off, but, it says, no peanuts, or depending how big, anaphylaxis to peanuts. And even if you don't subscribe to something like medical alert, you can get an engraved medical bracelet or something like that. Which I would recommend. And again, when you're by yourself, there's no one there taking that extra look out for you. Don't take any risks. Be careful. And this, as a dietitian, I try to eat healthy, but when I'm traveling a lot of times, I need to choose safety over trying something exotic or interesting or even healthy sometimes. So oftentimes when I'm traveling, if and I know you probably have heard this a lot, but I will look for certain chain restaurants that are able to accommodate my needs, because the chain restaurants I have found that many of them offer food allergen information on their websites. And so, so I can look at it there, I can ask at the restaurant, and I find that they may be less likely to vary some of their ingredients than some of the smaller places. So that, if I find that, then sometimes I might choose something at a fast food restaurant that might not really be my first choice, but I'm choosing this as safety of subsistence versus, an enjoyment food experience. So those are other things to consider for sure. Next slide. So if you're staying, like sometimes for work, I've traveled with other coworkers or other people for conferences who, it might be the first time, maybe you met them there or they're not that involved. They may need to know how to administer your medication. So depending on who that is, most of the emergency medications come with trainer demonstrations, so you could always bring that, let them know. You may need to let them know that there are certain places that you may not be able to eat at due to your food allergies. And so one way that I've sort of dealt with this over the years is that, and this just happened again on my last trip, is that there was a place that had like an indoor mall with food courts, and some of them were chain restaurants and some weren't. And that allowed me to choose the ones that I felt were the safest for me, but allowed my guests to maybe pick from places that I wouldn't eat at. So everybody kind of got their own option, but I still felt good about my plan, and I felt like that was giving them some variety instead of being restricted, like I was. And then the other thing is sometimes you could also do that if like your restaurant in your hotel has been good with you and you want to order something for takeout or something there, and your other person can order something else. So there are times that that I've done that as well. Okay, next slide, please. So again, for being safe, you want to bring some of your safe foods that might be difficult to find or are full of nutrition. Try to plan ahead the best you can. Chain restaurants may be an option for you. You still want to communicate and check along the way. And sometimes when I've been traveling, if I had a successful experience at one restaurant, I might visit that restaurant. If I'm there for a week, I might be there 3 times at that same restaurant because it worked out well for me, and I felt good about it, and there were options. Grocery shopping at your destination. So this can really help. If you have access to getting to a grocery store, if you're going to be there for a while, if you have a small refrigerator or room, there are grocery stores, pretty much everywhere. And so when I was just in New Orleans, I did go to the grocery store to get a few things. Even when I went to South Africa, for part of the time I was in Cape Town, which is a bigger city, but they actually had a grocery store right there. So I did get some things there as well. And, some places you can get timeshares or places with kitchens. If you're staying longer and you want to cook more of your meals, that would be something that you may want to consider. Sometimes being safe means that you are not eating something when somebody else does. And so pretty much the majority of the time, my rule is, no dessert. So high risk. The peanuts are a little too high risk for cross-contamination with that. So sometimes other people will eat dessert and I just won't. So this is where it kind of goes back to not feeling neglected, that you could bring, like I like chocolate, so there's several chocolate brands that I can have. I might bring one of those with me so I don't feel like I'm deprived if I want something while somebody else is eating something else. So again, you may have to choose safety over something that you really would like to have. Sometimes another way I've combated not feeling left out is when I've gotten home, I might have researched a recipe for a certain dish or a certain ethnic dish, and then tried to repeat it at home, give ingredients that I know are safe, and that's sort of been fun too. Single ingredient foods, anytime you have processed or more complicated foods, your risk of allergens might be greater. So, sticking to sort of some more plain foods may be a good goal for you. Packaged and labeled foods may also be well because hopefully they've been packaged, and labeled correctly, and so you feel pretty good about what you're putting in your mouth. Next slide, please. So when you go out of the country, there's a lot of different things you have to do. This is a picture of me back in the day in Australia for lacrosse with the kangaroo. Try to do your research ahead of time. The internet does make that easier. If you feel like you're not internet savvy, I'm sure there's somebody who could help you, or your local library. They're happy to help people with this kind of research. Communicate your needs when making any of your reservations. Try to learn about things that might be prevalent in where you're going that you might not know about. Bring, a chef card in the country's national language. There are several languages on FAIR's website that you can do. Bring some safe foods and consider going to a grocery store, the health insurance, and learn how to obtain emergency health services. Many places I have been, there has been somebody at a restaurant in another country that somebody speaks English. If you are trying to communicate and wondering if this is safe and you don't feel good about it, then don't do it. You got to sometimes go with your gut instinct, and there have been times where we've been into a restaurant, got some water, went through the menu, and then asked some questions, and I didn't feel comfortable, and so we would just leave and try a different one. Sometimes that might happen. Next slide, please. So there are some other special occasions that might get you for travel. Athletic events, mine is mostly for charity runs. And so those have their own set of nuances because often they provide snacks for after the event or throughout the event, and often they're things that I can't have, so I make sure that I pack something with me that I may need. If you're going to a bed and breakfast, which I have been to those before, that's often where breakfast is included. So depending on the place, they may or may not be able to accommodate you, or you may just be staying there but not eating the breakfast. So you have to communicate ahead of time and see how you feel about that. Birthday parties are a big one. This one comes up a lot, even locally. You know, when you're at a birthday party, the kids want to be like everybody else, and unfortunately, a lot of times, especially with the peanuts or milk or dairy or wheat, you know, you can't have the birthday cake. Bringing, you know, your child's favorite special treat can be helpful for them, with getting them involved in picking out what they would like to bring, so that they can have something to enjoy at the party. If you're close enough with the other people, you know, if there's something you can discuss with them, but ultimately I think it relies on what you do, you know, to protect yourself or your child. Fairs and festivals can be challenging because, again, you're not sure necessarily all the time about the food. Holidays, we have a lot of holidays where we have family meetings from all over, and that can be tricky, you know, trying to negotiate different things that the whole family wants to do, like eating out for holiday meals. Weddings has always been particularly tricky. Obviously, usually I don't have the wedding cake, but communicating ahead of time can make a big difference. I've been to some weddings where they've had it. They've taken great, you know, strides to make sure your meal is safe, and, you know, had special people deliver it to you. Conferences as well is another issue if food is included or involved that you want to do, or work functions. So they all kind of have similar needs, but maybe, you know, separate different nuances. Next slide. So now we're going to get into a few challenges. So the airplane I talked about a lot. You know, the reason for the airplane challenge is because, yes, you're up in the air. There's other people in there, and you're in an enclosed space. So I'm going to go over some of my others. I mean, I talked about some strangers eating peanuts, but when I was younger and not educated about this, I was on an airplane, and it had been flying all day, and they were serving peanuts in the little packages, and so all day long these peanuts were being opened, and I didn't have, at the time, which I still do, I have intermittent asthma when I get sick, but I actually started to go into like an asthma attack in the airplane from all the peanuts. And I was a teenager, so I didn't even think about asking. I was never trained about asking. And so I did have my emergency medicine, and I moved my seat, you know, next to the flight attendants to a place where I thought there was better air. And after that, I really learned about how you have to be very careful when you're flying and communicating. So I won't fly on any place that serves peanuts still to this day. There's something just about all the proteins at once being opened and sort of circulated around, and it just makes me feel better. Another flying incident I had was when two airlines merged. So US Air had bought another airline. This was a couple years ago, and I had communicated the whole way, and we were in flight from Philadelphia to Seattle via Las Vegas. And when they started passing out the snacks, a few rows in front of me, I started smelling the peanuts. So then I started getting nervous. You know, my husband said, you know, what are you doing? You know, and as soon as they found out, they did stop serving them. And there were a few rows for me, and I was okay with it. But then I had to connect flights, and I was really worried about it. And I was like, can you please call ahead to the other plane and let them know not to serve them, and, you know, tell them and all this stuff. So afterwards, I did write a letter to the customer service and did get a call back from one of the vice presidents that it was an error, and they were changing food service plans, and, you know, they apologized for it. And I think at the time it was FAN, the legacy organization, had gotten involved as well, and they fixed that. But, you know, I think speaking up for yourself as well is important. Being in remote places can be difficult because, again, you might not have as many options, and you don't necessarily know, you know, how close is the emergency care. So, you know, besides going to some of the other countries and remote places, one of my favorite places we went to was Sequoia National Park, which is kind of far out there, and they only had a couple restaurants there, and so we chose the better one, and I ordered something that was very simple and communicated that I felt good about. Not speaking the language certainly can be a problem. So again, using the chef card, you know, maybe trying to speak out if there's somebody that is fluent in both languages can help as well. I mean, worst case scenario, you may be able to get an interpreter. But I think the other thing is, you know, constantly sometimes feeling left out. If you have family or friends that look out for you and make sure that they had something that you could have and include you. That is always really nice and special. And time constraints, switching planes or trying to get from one place to the other and being hungry. Some of the other situations I've had, so I'm going to give you an example. This is on the challenge and the success page. So for Thanksgiving, as I mentioned, my family likes to travel a lot for that, to meet everybody. And this year we were visiting my sister's family, and this was a restaurant that we had communicated to multiple times ahead of time. We had my peanut allergy as a special need, and then we have a mobility accessibility need for my nephews that has a wheelchair. And they seemed great in the email. Everything went great. It's a busy day for them. It was a buffet. They said they'd be able to accommodate it. When we got there, the waitress had no idea about my food allergy. It was really busy. We were hungry. We had just literally drove in for this, and it took a long time for me to go through it, again with the chef and this and that, and then of course we followed up with the owner afterwards and got some apologies. So that was not ideal, just because everybody else was eating and I still was not eating, and I wasn't even sure if I could eat anything. And we had thought we had planned ahead, and then it didn't seem like, even with the follow-through, ahead of time, it didn't work out. So that was not, a desirable experience, but I did eat safely. Then another time, and I have a lot of instances, but these are just a few, in Old Town San Diego when I was a teenager, we went to this Mexican place, and they had a notation on their menu that said peanut butter was used in their enchilada sauce, and then, we communicated with the waitress who spoke English and said that that wouldn't be a problem, and I was still a little nervous about it, but I think at that point I was too young and not as knowledgeable enough to be forceful about it, that then when they brought my dinner, I saw that it had something dark on it, which I thought was the enchilada sauce, and so even though I communicated, they brought me a dish that had it on there, so of course I didn't eat it, but you have to sometimes, be careful every step of the way as well. And when we were in Mexico City, I noticed that there were some differences in the city versus maybe like the resort areas, because we've been to Mexico many times at resorts where they're used to getting people from other countries and speaking English, and some of the more local traditional places, I had a little bit harder time negotiating. My husband speaks Spanish, so he was able to assist in that, but it was a little bit more challenging, I found, than going to some of the resort areas. And here on the East Coast, there's a lot of peanut oil and peanut products at the beaches and on the boardwalks, and so a lot of the special treat items contain those allergens. And so it's, again, a place where you might want to bring something for your child or yourself that they can have, while everybody else is walking around eating, their ice cream or, their French fries or their popcorn that has nuts in it and things like that could be helpful. Next slide, please. So some of the successes are, sometimes I will bring a food to complement a meal out. So I might bring some, one of my favorite crackers is Mary's Gone crackers, which is nut-free, dairy-free, and gluten-free. So sometimes instead of eating the bread, because the bread can be questionable for not just the gluten, but for nuts, depending on the bakery, I might have that instead of the bread if I need it. Having several options or places to eat is really nice. I feel like that's great. If I have several options of places I can go and I'm traveling, I feel like, oh, that's good. I don't feel as restricted. Again, chain restaurants can be helpful in some situations, and obviously not having a reaction is important. On the opposite hand of the Thanksgiving buffet, one year we went to Pusser's, which is a restaurant attached to the Marriott in downtown Annapolis, and they were amazing. I mean, we communicated ahead of time. They said they could do it. When I got there, they had a list of all the buffet items, and they circled everything that I could have. The chef came out. He walked me through the whole buffet. He felt good about it. He even offered me several desserts that they'd made there on premise that were, free of any of my allergens, and they were amazing. I mean, it was a really great experience. And come to find out, one of the reasons they were so amazing is that the manager's son, I believe, also had food allergies. And so the whole staff, they ate there all the time, was very good with it. And so that was a much different experience for me. One remote place, when we went to South Africa, we went to an elephant park, which was pretty far away from where our base was in Cape Town. And to get there, it took a while. We spent the night overnight, I think maybe 8 hours, and it was past Port Elizabeth, which is a major town, but this was like an hour remotely from there on a dirt road and the whole thing. And they had a small kitchen there where they cooked the meals for the few people that were visiting it. And so, again, with the internet, I was able to contact them ahead of time to see if that would be something they could do before I made my reservations, and they said yes. And, still when I got there, checking along the way, letting them know. I was, a little worried at once, but they actually let me walk through the kitchen with them. They showed me, we went through the ingredients, and I was able to dine, there with their food and enjoy that trip without any concern. So that was great. Let me pick a couple other things. Canada, I find Canada is pretty easy to travel to. They're really great. Orcas Island is kind of remote, and then we stayed at a bed and breakfast that was able to accommodate me. So there's definitely places that you can go and have a good experience. You just need to, next slide please. You just need to use your resources and do some planning ahead of time. Now I know there was one question that came in that I just want to make sure I mention, and we will add this information up to the slides, that the European Union has just recently updated their regulations for how to label the foods for allergens. So this was at the end of December. So they're actually, the one thing that's really great about them is now the restaurant or cafe is supposed to have to disclose if it has one of the common allergens, and they consider, they actually have more allergens than we have. They consider, I think, 14 different foods, and that does include sesame, which somebody had a question about. And so they're trying to improve their labeling on their foods as well as in their restaurant. So on these resource lists, my website at eatfithealth.com, I have an food allergy resource page with a lot of links to helpful food allergy resources, and I added the European Union links so that you can read up more on that on your own. And if anybody ever sees anything that they think I should add to this list, feel free to email me. My email's on my webpage. But use all of these different things to sort of research and figure out how to make the best plan so that you can, you and your family can explore the world without feeling like that's one thing that you can't do with having food allergies. I think we're almost out of time. I'm sorry.
That's okay. This has been a very thorough presentation. Just to kind of interject on that, we are going to be probably limited in being able to take questions other than the ones that were advanced prior to the presentation, although I think a lot of information was covered throughout. But if you do have questions that you would like answered specifically, you can email me at lheun@foodallergy.org, or you can also email info@foodallergy.org. And it'll get to the right place. We'll forward any questions along to Lori. If Lori, you would be so kind to help us respond to some of those questions after the webinar.
Sure. Okay. Yeah, sure, no problem. I can cover one that you gave me. I think we have time for that, if that's okay. So somebody had sent in a question about traveling to Paris with a life-threatening allergy to all nuts, and they wanted to know if you had to be careful with flour products because they could contain lupin, which is a not necessarily a specific nut, but it's something that's more prevalent in the European culture. And I don't know that there's my answer would be to check with your allergist. I don't know that there are good numbers on how many people have. I've seen numbers such as 17% of people with peanut allergy may have a reaction to it. It's used in Europe and Asia, and it's a garden flower with seeds. I actually, this is, again, check with your allergist. I've actually eaten this, the beans, the flour and the seeds, without knowing, because this was before, I even knew about any of this, and I technically was okay with it, but I would definitely discuss it with your allergist. If it's a place that you're going to travel and you want to know, you could ask them, and I don't even know if they would do it, but my allergist has skin tested me with certain ingredients before. It would be something that you would definitely want to discuss with your allergist about. Okay. Anything else?
Do you want to move to the, I think there were a couple more slides that we had if you wanted to.
Oh, yeah. So basically, I think I sort of summed this up already several times, but the planning, I think, will help you have a more enjoyable trip. The other thing I have to say is when you get to your destination, you may have done some planning, but I try to walk around the area to see, look for restaurants when I'm not hungry. So, say I've eaten lunch and we want to know what we're going to do for dinner. I don't wait until 5 or 6 to figure out where I'm going to go for dinner. I might, walk around, check the menus out ahead of time. Oh, maybe we could go here. Let's ask. And anytime you're contacting a restaurant, at least here in the U.S., a good time to contact them is between 2 and 4 p.m. because it's after the lunch but before the dinner, and they have more time to sort of accommodate your questions. So I find I get better service if I do that, and identifying some options before you get to the time where everybody is really, really hungry can definitely help. Okay, next slide. So again, most everywhere you can find somebody that speaks English that might be able to help you. The internet is great. Take advantage of the food allergy community. Other people, there's a lot of different sites. There's FAIR. There's the different support groups. Simple ingredients, bringing your safe treats. When we went to Mexico this time, we did go farther out to this pyramid, which was sort of remote, and they had a few restaurants right there. We were with a large group of people, and I picked something that was very simple, that didn't have like any sauce or anything on it, and we communicated. So it might not have been my first item of what I really wanted to eat, but it was what I felt was, the best choice at that time. Next slide. The things that I pack mostly are hard to find. Full of nutrition, meaning not just candy or chips type things. A few treat items, easy to prepare, travel well, and your favorite. So if you have something you like to make and you can take some with you, like a homemade granola, which for me is hard to find without peanut contamination, so I make it at home with pumpkin seeds and an almond that I can eat because I can do that. That's not contaminated with peanuts, then think about those are the things that you may want to bring with you. Next slide. And here's just a picture. This is actually some stuff I had packed once. I have a list of some of the bars that I can eat on my website on the food allergy. I also, I know some people can't do sunflower seed, but I can do sun butter, so they sell cups. I buy them online, so sometimes I pack those, the little individual cups. Oatmeal packets that can easily be heated with water in a hotel room. Chocolate, because that's one of my favorites. I really enjoy the Enjoy Life Foods trail mix. Sometimes I've done the canned chicken, roasted chickpeas or sunflower seeds, and Mary's graham crackers. These are some things that I commonly will bring with me. Next slide. And here in the U.S., here's a few of my favorites. So I mentioned Disney a lot. That's definitely one of them. In New Orleans, every time I've gone these last 2 years, I've been to this place several times. They're really good with food allergy. Obviously, if you can't have shellfish, it's not a good option, but it's a stand actually in their marketplace. One Dish Cuisine, if you ever have the chance to go there in Ellicott City, Maryland, which isn't too far from Baltimore, it is fabulous. It is free of all the common allergens. They do have 2 kitchens in there, one that's milk-free, and they do have milk on the milk side. The owner has celiac, so she realizes the importance of food allergies, and they have a lot of options, and the food is really great. They make breads as well, and it's fabulous. You can check out their website, and they have a Facebook page. And going to the fair conferences is like a little vacation for me because every time I've been over the years, they're really great, obviously, with labeling and identifying the foods that you can eat. So I always feel really good about that and being with other people who understand the importance of your food allergy. And then since my sister lives in North Carolina, often I do drive down there, and one place that I've stopped at several times in between the way is an Italian restaurant in Fredericksburg, Virginia, who they also have a family member with celiac, so they're pretty knowledgeable about all the food allergies, and they offer a lot of gluten-free items. And so these are just some of my favorites. And the last thing I'll mention is if you're traveling and you're not sure if they can accommodate your allergy, if you see any notation about food allergy, or if you notice that they seem to be understanding gluten intolerance, which more people seem to have or avoid than, food allergy, that might be a good place to start and asking if they can accommodate your allergy, because then they understand the importance of, ingredients that need to be avoided or monitored. So that might be another tip for you. Okay, last slide.
Okay.
Well, I want to thank you for listening to me today, and I'm sorry I took a lot of your time, but I'm hoping that everybody took something positive away from the talk today. And feel free to email Lynn, like she said.
Well, and I also want to point out that Lori has very graciously included her Facebook information and her Twitter and her website as well. But if you have questions, probably the best email to contact us is info@foodallergy.org. Those emails will come directly to me, and then I can go ahead and send them directly to Lori for any questions that were not covered. But I do feel like a lot of questions that came up during the presentation were covered within the presentation, so hopefully you do feel like your question was answered. I want to thank you again, Lori, so much. This was such a thorough presentation, and I think it's going to be really helpful for all of our community members, and it will be saved on our website under our webinar section under our tools and resources. So next,
thank you.
Our webinar is going to be Dorm Life and Dining Plans, which is going to be focused on planning for college with food allergies. We're going to be doing an update on our college program, the Fair College program, as we enter our pilot stage and start putting in some best practices with some of our partner schools. And Christy Grimm, our college outreach manager, will be leading this presentation. It's also going to address strategies and best practices for parents and college-bound students for managing food allergies on campus. So I know that that is another very popular topic within our community, so we hope that you'll be able to join us for that as well. That will conclude today's webinar. Once again, I want to thank all of you for joining us, especially Lori. Thank you for joining us today, and we hope to see you all again next month.